Hey everybody, it's Dr. Wood, and today we're going to be covering Chapter 19, where we talk about different forms of nutrition. So, this is something that is a frequent presentation for a lot of patients, and oftentimes they may not know it, but just looking at some common signs and symptoms that can pop up with patients with maybe nutritional deficits or maybe overages in rarer cases. But they could have things like abnormal bone function, like perhaps they have osteoporosis, they could have neurological damage, they could have low energy or maybe too much energy, they could have muscle wasting. There's a lot of things that go into this. And as we mentioned before, that this is very non-specific. They may appear like other sorts of conditions, and so this is an important thing to rule out. Make sure they don't have any kind of nutritional imbalances that could be leading to some of these things. Because if you can identify that, it's a pretty easy fix for most of them. Now, what are some common side effects of people who are taking vitamins, minerals, and potentially herbal supplements? Well, could be very nonspecific as well. Probably the most common thing you'll run into is going to be things like indigestion, nausea, diarrhea. That's probably the most common, but certainly in some other cases you can find things like anorexia, where they don't want to eat, irritability, etc. A lot of it is going to be very dependent on the actual vitamin, the actual mineral, or the herb itself that they're taking, because they could have very specific sort of side effects associated with them. Now, in general, vitamins are going to be a sort of general term for any sort of organic substances or nutrients that are necessary for our normal just functioning in life, right? For normal growth, development, metabolism, all those things there. And so they are frequently needed in relatively small amounts, most of the time because they're acting as things like cofactors for different types of reactions. And you'll find that the amount we actually need can vary greatly depending on the type of patient you're dealing with. So if they are pregnant versus if they're kids or elderly, you'll find that their needs will vary pretty widely based on what kind of biochemical processes they're actually going through at that point. Now, most American diets you're going to find contain pretty minimal amounts of specific vitamins here, and so a lot of that could be related to certain types of foods that they're consuming, or perhaps if they are certain socioeconomic statuses, maybe they don't have access to good nutritional foods, things like that. But to break them down into sort of two main categories, we're going to have our fat-soluble and water-soluble vitamins. The big difference between these two is that the fat-soluble vitamins usually like to hang out for long periods of time in the body because they are fat-soluble, so they can go into our fat and we can store them for a while. There's only 4 vitamins that fit into this category, and it's A, D, E, and K. It's a very good 4 vitamins to remember as being your fat-soluble ones. These are also ones that it's a lot easier to potentially take too much of because you do hold on to so much of it. On the other hand, you're going to find that all the other vitamins are going to be more water-soluble, meaning they get either metabolized or excreted from the body very quickly. I'm sure some of you may have consumed an energy drink of some sort, and if you look at the actual content of a lot of their water-soluble vitamins like vitamin C, vitamin B, variety of vitamin B varieties are in there, you're going to find that they will oftentimes contain thousands of percentage of what you actually need in a given day. And I've seen some that are like, has 3,000% of the vitamin B12 that you need. And that's okay. It can have a lot of it in there because what we don't need, our body will just urinate out. That's why frequently you're going to find that the urine will change color. It'll be very kind of like almost neon yellow or green when you have patients who are consuming a lot of energy drinks because they're just urinating out so many of these vitamins and other components of those energy drinks. Now, in terms of compliance and how we educate our patients about this, it's important that we consider both external supplements of these vitamins and also what they're taking in their diet, right? So oftentimes we may be recommending that in addition to their normal dietary sources, they're going to be taking extra vitamins on top of that, right? And so for a lot of healthy, non-pregnant, non-smoking adults, they may not need any specific vitamin supplements. The reason for that is that a lot of the foods here in the U.S. tend to have enrichment or they are fortified, meaning they have synthetic vitamins are added during that process, right? So they have things like iodide, they have things like vitamins B added to them, and the reason for that is because we understood that vitamin deficiencies are a big problem, especially in children, which is why we fortify the foods in the first place. Now, people who might require external vitamin supplementation could be if they have, say, for instance, chronic disease states, athletes who may be kind of going through their vitamins very quickly, smokers, things like that. So depending on the situation, they may require additional vitamin supplementation. So here is a good table kind of going over where you're going to find your fat soluble vitamins, so, and also just their functions and other things like that. So you can go through most of this on your own, but just to kind of go through and look to see how they come normally. Typically we're going to be looking at these in either oral or say intramuscular, subcutaneous sort of supplementations here. For the most part it's going to be oral though, but you can see the function of each of these here. And so for instance, like vitamin K is really important for synthesis of blood clotting factors, right? And if you don't have enough clotting factors, well, what do you think could happen if you have too little vitamin? Well, if you look here, you can see this hypovitaminosis, they get bleeding and hemorrhage. Well, that makes sense because they can't produce those clotting factors. On the other hand, though, let's look at something like vitamin D, which is really important for calcium and phosphorus homeostasis in terms of how much we absorb from the GI tract, how much we get to put into the bones. Well, what happens if we have too little? Well, we get osteomalacia and osteoporosis because we don't have enough calcium being laid down in the bones there. So again, these are good tables to go back to and understanding kind of what we see if we get too little, which is more common than not, and then what we end up seeing if we get too much of the products. I'll tell you, as a clinician, I rarely see patients who have presentations where they have too much of a given vitamin. Very frequently it's where they have too little, okay? So looking into the water-soluble vitamins, as I mentioned, mostly it's vitamin C, different forms of vitamin B. Note here as well that you're going to find that different B vitamins will also have other names associated with them. So for instance, vitamin B12 is also known as cyanocobalamin. For instance, vitamin B6 is pyridoxine. You'll find that there's a lot of different varieties that are out there. And again, you typically will find that with the water-soluble vitamin deficiencies, there's very specific sort of issues that pop up mainly due to the hypovitaminosis there. So for instance, if you are lacking vitamin B12, you have problems with anemias because you can develop this abnormal blood cell formation, right? So that can be an issue there. Vitamin C can develop scurvy if you do not have enough vitamin C. That's why we always talk about pirates getting scurvy because they were on these long voyages where they did not have any access to fruits and vitamin C. So you can kind of go through and kind of see all the issues they run into. As I mentioned, it's probably more rare that you run into someone with a water-soluble vitamin deficiency just because so many of our foods end up getting supplemented with a lot of these. So switching gears and going into minerals, you're going to find these are going to be inorganic solid substances. These are frequently things like metals and things like that, and they are also needed for the body to function well, right? And so we're going to find that mineral supplementations may be needed during rapid growth periods, right? So you could consider, say, for instance, during pregnancy, certain clinical situations, or if they're having certain drug therapy. So for instance, if they're taking a diuretic, which is something that causes you to pee out many of your minerals, then we may need to supplement that. So for instance, if someone is taking the diuretic Lasix, furosemide, they end up losing a lot of potassium, and so we then have to give them potassium supplements to make up for that loss. So some of the major minerals you run into, first off is going to be calcium. This is really, really important for formation of bone, formation of teeth, but also other things you have to think about. It's used in blood clotting. It's used in things like insulin secretion. So that could be a problem for diabetic patients. Also, just your muscles, to be able to contract and relax normally, you need that calcium there. And so oftentimes we're going to think about supplementing calcium in patients who need a lot of calcium, especially for their bones. And so that's why we think about things like calcium in postmenopausal women, because they are lacking estrogen, and that causes a lot of their bone formation to be altered such that they need more calcium and vitamin D to make sure that they have, keep as much bone density as they can and not be at risk for things like fractures. Phosphorus is another one. Typically, you're going to find that we don't have specific phosphorus supplementation. It'll oftentimes come in from our diet. So, for instance, we get a lot of phosphorus from just eating meat. But also, you're going to find that this will be included with other mineral sources. So, like calcium phosphate or things like that will be utilized in order to get that phosphate in there. This is also utilized for energy, which makes sense because if you think about the main energy currency in the body being ATP, lots of adenosine triphosphate. So phosphate provides really high energy bonds that allow us to do everything for life, because that's the main way we utilize energy. Magnesium is going to be another one that's useful for several things such as muscle contraction. This usually uses a cofactor for a lot of enzyme activation, things like that. And you're going to find that frequently magnesium is going to be found in combination with a lot of other supplements, such as like calcium and things like that. Certainly, you can find them in places like milk of magnesia, slow mag, Epsom salts, etc. Again, this is another common one that if patients are on diuretics, they end up losing a lot of this. And so frequently, patients will have a hypomagnesemia that is undiagnosed. And that's oftentimes a thing that we could do as a clinician is think about, well, let's get a magnesium level to see if we need to replace this. Next off is sodium. Sodium is absolutely critical in the body. Without proper sodium levels, you're going to find that we will develop issues of neuron function. Patients who develop hyponatremia frequently present with altered mental status and seizures. Very, very important to keep sodium in check here. And so frequently, especially in cases like dehydration or severe diarrhea, things like that, we'll find that sodium supplementation is really important because they're losing a lot of that, especially in sweat and things like that, which is why a lot of your sports drinks will have sodium included in that and part of that electrolyte mix. And frequently, what we'll find with patients who are like really ill and they are dehydrated or they're having vomiting, diarrhea, etc., we oftentimes recommend not using sports drinks because even though they have electrolytes, they don't really have as much as they truly need, which is why we still recommend Pedialyte. And so we'll have adult patients to say, but I'm not a child, why do I need Pedialyte? Because you need your electrolytes, and Pedialyte has a good balance there. Next we have potassium. This is another really critical function of the intracellular component. Even though potassium levels look low in the blood compared to say something like sodium, you're going to find that a lot of that gets actually held up in our cells, and it's really critical, especially for things like muscle function, but really so much for cardiac muscle function. If you have potassium levels that are out of range, either too low or too high, you can develop arrhythmias and death from that. So it's really, really important that we make sure potassium levels are kept in check, especially if they are on something like a diuretic where they're losing a lot of potassium. You got to supplement that stuff. Okay. Chloride's another one. This serves as a buffer. Frequently, though, you're going to find that you will have this included with other supplementation. So, for instance, sodium chloride, salt, you'll basically get your sodium and your chloride all in one thing there. So this is not something you have to consciously think about replacing, but one big place that we could lose it is actually going to be as part of the gastric secretions, right? HCl is what gets secreted there. So you can have patients who have a hypersecretory disorder where they're releasing a lot of that, and they can develop hypochloremia. Iron's going to be another one. This is really important in terms of just hemoglobin function. So if you look at a molecule of hemoglobin, there's 4 iron molecules there. And so it's really important for function of the blood. If you don't have hemoglobin, you can't transport oxygen effectively. And so it's why we always include that. A lot of patients who are iron deficient develop anemias and have a lot of problem where they just are tired all the time. They may look a little pale. It's because they can't form enough hemoglobin, right? Big side effects you're going to see with iron supplementation is going to include they can darken their stools, and this is important to warn patients about because a lot of people think about dark stools, they think about a GI bleed, and so in this case here it's just an iron. This is also going to cause a lot of constipation, which can be problematic for patients who may be already constipated, or if they're taking other medications, it can cause that as well, right? So it's really important, though, we never mix iron and other antacids, things like calcium carbonate, things like magnesium hydroxide. Don't mix these together because iron tends to bind with them, and once they're bound up in the GI tract, then they just get eliminated through the feces and they don't ever get absorbed. Some other trace minerals we like are going to include zinc. Zinc is really important in terms of as a component of DNA and RNA. We also need this for things like wound healing. So if we have cases where patients are zinc deficient, they oftentimes will have these wounds that will not heal properly, or they'll take much longer to heal. So that can be a problem, why we like to replace those. Other things like fluorine, fluorides, these are good in terms of protecting against cavities, dental caries. Also in bone formation, frequently you're going to see that a lot of, especially in industrialized nations like the US, you're going to find fluoride's going to be included in the water, especially like city-provided water, things like that. But this is another one you want to make sure you don't take with, if it's specific fluoride supplement, you don't want to take with milk or dairy products because it'll actually bind up to calcium and then you don't get the benefit of it. Now, one thing to note here, this is what we call trace minerals, which means you only need very, very tiny amounts in the body or tiny amounts in the diet to actually intake in order to get normal function. So you really don't need a lot of zinc or fluoride, but if you don't have enough, this still can lead to some problems. Now, in terms of herbal supplements, this is always a tough thing because I think a lot of people have very strong ideas on the topic, whether they are really gung-ho about herbals or they are really anti-herbals. The big things to note here, and this is a good thing to educate patients about because they may not know this, is that we consider them dietary supplements, right? Just like a lot of the vitamins that we have, and they're not regulated by the FDA, okay? So whereas with most normal prescription drugs, they have to go through the FDA process to get approved and go through clinical trials. Herbal supplements do not have to do that, okay? So they can come out in the market, they can sell themselves, but they have to make sure that they are avoiding certain statements, right? So for instance, you can't have a supplement that comes out that says this will help you manage diabetes, because that's treatment for a disease and they're not allowed to do that. So frequently the FDA will pull those herbal supplements off the market because they're making spurious claims about health problems or health benefits. What they can say is that it can help with glucose metabolism, or they can help with normal bone function. Like, they can say that they can help with normal processes. They can't say anything about treating a disease. So that's one thing to note with the marketing of herbal supplements. But make sure you ask your patients about their use, because if you end up missing this, they can have a number of drug interactions that can be really problematic. I remember one patient that we had come into the ER. She was an elderly lady, and she was worried about her memory going, and so she wanted to take an herbal supplement to help with that. And so she was taking ginkgo biloba. Well, she also had a history of atrial fibrillation, and in order to prevent clots due to that, she was on a drug called warfarin, which is a blood thinner. Well, warfarin will thin the blood, and then ginkgo actually has some anticoagulant function as well, meaning they also thin the blood. So what happened? Well, the two combined together, or they interact with one another, basically caused a massive head bleed, and the patient died from that. So they're not, they definitely have their issues. They definitely have potential side effects and drug interactions. So you have to ask about it. And you want to ask in a very curious way, not to be, not to try to shut patients out. Even if you don't believe in it, you still got to know about them, right? I also try to help patients purchase it from a reputable source, because there's not as much regulation in terms of how they produce it, and what they say is on the label may not be what's in the actual product. So say buy from a reputable source. Try to get the same source every time, so you at least get a consistent product. As I mentioned, make sure they always inform providers about their herbal therapy to make sure they avoid any of those drug interactions. And again, just some issues or common reasons for the use of dietary supplements. It can range from anything from burns and allergies all the way down to urinary tract and irritability. Again, some of these can be quite effective for what they do, right? Some of these may not be as effective. We don't have a lot of studies, though, to really help us out and tell us that in a lot of cases. And so that's why it becomes very difficult to determine like what's really going to be working and what's not for your patients. But they can try it for sure. And certainly we let them know, hey, at least let us know about it, so that way we can make sure we avoid any medications that might interact. So other examples of, like, say, toxic effects of herbals, you can see things like, as I mentioned, garlic and ginkgo can react with anticoagulants. So that makes sense based off what we mentioned a few minutes ago. Another one you can see in terms of effects can be things like foxglove. You can see lily of the valley. They can cause potential cardiac effects. They can cause ventricular arrhythmias and death potentially. So again, they need to be used with some evidence behind them. It's good to have good resources to help you out determine what's going to be right for your patient in terms of herbal supplementation. So there's also the consideration of home and folk remedies. So these are going to be things where maybe grandma says if you drink chicken soup out of a shoe that it'll help with your bronchitis, right? These are things that may be passed down from generation to generation. Very frequently are going to be cultural, and some of them may have more questionable therapeutic value than others. And so it's important to consider these and ask about them, right? You at least want to know, because if you don't know about it, then that's going to be a problem, because that can cause interactions potentially, or it could maybe be working against your drug therapy, could be helping it, you don't know about it. So you got to ask the question. But for instance, some of them may not be all that dangerous in the first place. So like hot chicken soup for fever, cold, and flu. Well, those patients are usually pretty dehydrated anyway, because they don't have good PO intake. They're probably having vomiting, diarrhea. Well, guess what's a lot of chicken soup? It's a lot of salt, right? It's a lot of sodium. They can replace what they've been missing because of that. So that makes pretty good sense here. But other things like using onions applied to the feet for fever, I've never seen a study that says that helps, but I'd at least want to know about it if my patients was trying it out. So it's important, though, to make sure to not be judgmental when you ask patients about this. Make sure to keep an open mind, because that will allow them to feel more comfortable communicating with you. Because the second you start to show that you maybe don't believe in what they believe, or that you are maybe mocking them because of it, they're going to shut down pretty quick, and then you're not going to get any information out of them. So that's it for this section. If you have any questions, let me know, and I'll talk to you soon. Thanks a lot. Bye.